tracking the coronavirus outbreak.
And good afternoon. You've been watching an NBC special report, but we have more breaking coronavirus updates now here locally.
The Ottawa County Health Department holding a news conference just an hour after we learned Holland's Tulip Time Festival is being canceled. Let's listen in right now.
And I will close with questions.
Good afternoon and welcome. I'm Al Vanderberg, Ottawa County Administrator, and I thank you for attending our coronavirus briefing today. Ottawa County offices, departments, courts, and staff have been working hard for the better part of the last week to keep up with the rapidly changing status of the coronavirus. We have also been working diligently to minimize the impact of the virus on operations and provision of services necessary to the health, safety, and well-being of our residents and visitors. We are also very concerned for the welfare of our employees who play such a critical role in delivering excellent services to our people. We are implementing recommended social distancing measures by delivering more services online, by appointment, by assigning employees who can work from home to do that, and by delaying meetings and other proceedings that can be delayed without consequence to those being served. We are also significantly reducing both the size and number of meetings in our facilities. The Ottawa County Public Health Department is the point agency for responding to the coronavirus, and our emergency management function closely supports public health. The Sheriff's Office, courts, HR, IT, facilities, and Corporation Council have also been heavily involved in the response to the coronavirus situation. We pride ourselves in Ottawa County on partnerships in the public, private, and governmental sectors to attack problems, and you will see this clearly in the comments that follow, that there's been an excellent team and a community-wide effort to address this situation. We will remain vigilant and committed to providing excellent communication and services during this time. Thank you.
Thank you, Al. My name is Lisa Stefanowski, and I'm the Ottawa County Department of Public Health Health Officer. I wanted to start by saying these are unprecedented times, not just for us here in Ottawa County, but for all of us in Michigan and throughout the United States. First, I want to also mention that all of us up here are part of this community. We care deeply about you. Every action that we take is with the best interest of our citizens at the core of everything that we do. We know that this is very difficult for people. Decisions are being made that impact people's livelihoods and their children's education and a whole host of things that are very impactful. And there are many unanswered questions. We may not be able to answer all of those today, but we do want to provide you with assurance that you have a team of experts on the job that are working on your behalf. The majority of residents are at low risk. I really want to emphasize that. Most often, people have mild symptoms, and they will get through this if they do get coronavirus, and they will be fine. So we can eliminate a little bit of the fear by just knowing enough about the disease to know that it's not horrible for everybody. I also want to mention that we need to count on every single one of our citizens to help mitigate this disease. We need everybody to be following the orders that are being put forward to mitigate this. We need everybody to cover their mouth when they sneeze and wash their hands and do all of the prevention strategies that are being put out before us. And if we do this, we will get through this together with minimal ramifications. Just to provide an update for you, yesterday the Michigan Department of Health and Human Services notified our department, the Ottawa County Department of Public Health, of our very first presumptive case of COVID-19. This initiated an extensive investigation which includes the identification of close contacts as well as appropriate quarantine and monitoring measures for those that may have come in contact with that individual. The weekend also brought executive orders by the governor, which included prohibiting large assemblances and events, temporary school closures, restrictions on entry into healthcare facilities, congregate care facilities, and juvenile justice facilities. Public access to restaurants, bars, cafes, coffee houses, theaters, libraries, fitness facilities, and any other places where people are gathering is now also prohibited under this governor executive order. The Ottawa County Department of Public Health is working closely with all of our community partners to provide education, prevention strategies, access to testing for COVID, guidance for healthcare, education, and our other human services partners, as well as fulfilling our very important public health responsibility of disease investigation, surveillance, and mitigation to stop the spread of COVID-19. We have a team of experts looking out for the community's best interest. We are well trained. We do this kind of work every day, and we are on 24/7 to ensure that our community is healthy and safe. We are also working throughout the region with our state partners as well as all the other health departments in Michigan so that we are all acting in unison on our public's behalf to again do an effective emergency response. Thank you.
Thank you. I'm Dr. Heidel. I'm the medical director at the Ottawa County Department of Public Health. And Lisa and Al have covered it very nicely, so my remarks will be very brief. We just want you to know that we are working very closely with our community partners, and we're working closely to identify individuals who may have come in contact with the patient so that we can take appropriate steps to monitor them closely. We are continuing to collaborate with the state health department and recommend that residents continue to practice preventive measures to slow the spread of COVID-19. It is the priority of the Ottawa County Department of Public Health and healthcare providers to protect patients, staff members, and the community by minimizing the spread of COVID-19. We are prepared and have appropriate protocols in place with healthcare facilities. Hospitals and care facilities have implemented strict visitor restrictions and screening at hospital entrances, which will take a good step toward doing this. Basically, we want to reaffirm that we are taking all available steps to ensure the safety of all Ottawa County residents.
Good afternoon. I'm Steve Kemker, the Sheriff of Ottawa County. The first and foremost mission of the Ottawa County Sheriff's Office during this COVID-19 event is the safety and security of our citizens and communities here in Ottawa County. Many of the precautions and change of doing business that we have put into place are for the well-being of our citizens and first responders. The changes put in place at the jail are also for the well-being of the jail staff and our inmates within our facility. Things are still changing by the hour. This makes this a situation that's very fluid, and more changes may have to be made in the future in the law enforcement world. Last week, Friday, restrictions were put in place at the Ottawa County Sheriff's Office. I want to assure you that road patrol services are fully operational, and we are responding to calls for service. If you call for law enforcement services in Ottawa County, 911 dispatchers will be asking more questions of the caller to screen. Also, deputies may be calling the reporting party depending on the type of call. You may be asked to meet the deputy or other first responders outside whenever possible. I want to stress that we are still responding to emergency calls and on calls that require a deputy to be on scene. A few things that have taken place at the Sheriff's Office. Currently, fingerprinting at the Sheriff's Office is suspended unless they are court-ordered fingerprints. We are getting a lot of people with walk-in traffic today dropping off their gun registration paperwork. We are asking that you mail those into the Sheriff's Office. and our mailing information can be found on our website. We have suspended all visitors into the Ottawa County Jail facility. Any arrests coming into the jail are screened by jail medical personnel. The jail facility here at Ottawa County has 24/7 medical staffing and services located inside the jail. The Sheriff's Office, again, is being kept fully informed by the Ottawa County Public Health and updates and changes during this event. And again, as that information comes into us in law enforcement, there may be times that we may have to adapt and make changes in the way we are doing business. In the future, any news information will be given out for the Sheriff's Office by Captain Mark Bennett, who is currently assigned to the Joint Information Center located here in our Emergency Operations Center at the Sheriff's Office. I would also like to encourage people, if they have questions, they can call in to see what services are available, but also on our website at the myottawa.org/sheriff is information, and we will keep that current and updated, and also on the county's main website. Next, I'd like to introduce Nick Bonstell, Director of Emergency Management for the Ottawa County.
Thank you, Sheriff. Ottawa County Emergency Management opened the Emergency Operations Center on March 11th in response to the state emergency declared at both a state and national level. The Emergency Operations Center is in full support of the Ottawa County Department of Public Health, who is the lead response agency. And I will tell you, they have been doing a fantastic job here in Ottawa County. Very proud to work right alongside of them. The Emergency Operations Center is coordinating between all local jurisdiction fire departments, EMS agencies, law enforcement jurisdictions, hospitals, volunteer agencies, K-12 education, and higher education within Ottawa County. In addition, Ottawa County Central Dispatch has implemented a call-taking process to ensure safety and health for our first responders. You guys, if you call 911, will notice just a little bit of difference in the questions that are asked, and that is a screening tool to ensure that our first responders are given enough time to don PPE, obviously, before entering a structure. With our mission in mind, we want to make sure that everyone practices good health habits, including, in these times, appropriate sleep and managing stress. We see both the physical aspect of COVID-19 in Ottawa County, but we also see the mental aspect of COVID-19 in Ottawa County. So good stress management goes a long way for us. Overall, we will continue to communicate with our local, state, and federal partners. We're in daily contact with the State Emergency Operations Center in Lansing, and we will get through this all together as a community. I feel that very strongly. We have great community approach to this event, and we will be here to support it for the long run, for sure. So with that in mind, one of the awesome efforts that have happened here within Ottawa County is a volunteer community effort through a number of agencies, and I am very, very proud to introduce Community Spoke and United Way. They're going to talk to you more about the volunteer outreach and opportunities, both to volunteer, donate, and then also for the people to receive those goods. So come on up. Appreciate it.
Thanks, Nick. My name is Patrick Sisler, Executive Director of Community Spoke in the Lakeshore Nonprofit Alliance, and I'm here representing a strong network of government and nonprofit agencies that came together in response to the human services needs that we know will increase with COVID-19. Initially, we're very concerned about individuals or students and families, as well as isolated seniors, and making sure that they are fed, that they have the appropriate basic needs to weather out the next couple weeks, and that they stay housed. And so a group of us started meeting last Friday, and the first thing we did was launch a website that went live on Saturday, careottawacounty.com. And on that website, you'll find several ways for the community to get involved. First, there's a link for volunteering. And that link for volunteering will go to the Greater Ottawa County United Way's website, and I'll let my friend Shannon talk about that in a moment. The second link that we provide on that website is to donate goods. And so we identified 5 key agencies in Ottawa County representing different, more populous areas. And they all have listed the top 10 items that they need currently and anticipate needing in the weeks to come. And so please consider donating goods. We'll continue to update that with additional food and household items that may be needed and additional agencies that may need those items. Third, we created an opportunity to donate financially. So we know it's going to take more than in-kind goods to weather this, and so there's an opportunity to contribute financially to these efforts. And with that, we have 3 amazing funders in our community, the Community Foundation of the Holland-Zeeland area, Grand Haven Area Community Foundation, and the Greater Ottawa County United Way, who have already pooled money, $85,000 to begin with, to help address some of these emergency needs. And so they're providing some funds to the nonprofits and agencies in the area that we know are going to be hit first with human services needs. We also have a link on there for those who are seeking help, which will direct you to call 211, which is the primary place we hope to send people that have human services needs or questions. This team, this Human Services Response Team, will continue to meet daily and address what issues are out there and address them as we are able. And a message to the community is, while you're taking precautions to stay healthy, we also would encourage you to step up and help your neighbors by volunteering, donating goods, and donating financially. So I will turn it over to the United Way to share more about the volunteer approach.
Thank you. Good afternoon. My name is Shannon Beam with Greater Ottawa County United Way. United Way and the EOC and the many professionals sitting at the table have been working diligently around the clock to come up with best practices and strategies to address the upcoming needs of our community. One of the ways that we do this is with volunteers. United Way has mobilized almost 200 volunteers in a very short period of time, which is such a testament to Ottawa County and its residents. With this influx, things take time. We're in the process of background checking and vetting our volunteers. Once this is complete, we'll bring them to wherever the needs may arise, and we are specifically looking for volunteers aged 18 to 50. Volunteers who are 60 plus or over, we'd love for you to volunteer, but volunteer remotely. So we'll have you call your neighbors, your friends, and your family to check on them. And we're in constant contact with agencies to be sure we capture as many needs as possible. So if you'd like to give or volunteer to the cause, please visit ottawaunitedway.org. Thank you.
Thank you, speakers. Before we jump into the question and answering, let me just remind people where they can go for more information. We will keep our Public Health Department webpage updated, and you can find that at miottawa.org/MIHealth. We will have up-to-date information on there as far as our Ottawa County response, and also links to the governor's executive orders. You can also find those on the state website at michigan.gov/Whitmer to get more information on some of the details of those executive orders that have come across in the last few days. You can also find more information on the state's response for COVID-19 at michigan.gov/COVID-19. We will be posting this live streaming on our Facebook account for Ottawa County, so if you missed, if you have friends and family who may have missed this announcement, please share via social media. And with that, we'll open up.
The first positive presumptive case, with more details about that, any indication that a person came in contact with any other individuals, family, friends, etc.?
I'm afraid I can't give you a lot of information right now. As I said earlier, we just were notified yesterday. We worked late into the evening, started to do our investigation, and that's really where we still are today. The case is under investigation. We're doing everything we can to find out as much information, again, to protect the spread of COVID. So we will keep you posted. Another thing that's very, very important, I know lots of rumors are swirling around, and sometimes people think that when we say we can't give you any more information, that we're withholding information. That's really not the case. We take our responsibility for protecting the privacy of people's health. And we take that very seriously, and that's really the only thing that we're doing. But what we can do is we can promise you that if this individual who has a presumptive case has come in contact with anybody in the community, that person will be getting a call from us. So we're on top of it.
Do we have an ETA for a possible exposure point list for that individual?
I'm sorry, I can't answer that. I just don't know at this point. And so I guess no, I don't have an ETA for that. Unless, Doc, do you have a...
Well, it just depends on how many people we turn up as we do our investigation. So,
But in terms of like potential businesses or things like that, and any sort of timeline in terms of that information?
well, those are certainly one of our priorities right now. But again, unfortunately, at this point, as Lisa said, the investigation is just really in very early stages. So we can't really, at this point, give you an ETA. I would rather say we don't know at this point than to give you a date and then not be able to uphold that.
Is there any thought about beaches, your state beaches and the county beaches, those parks? Is there any thought to what's going to happen with them, or is it still too early in the season?
You mean in regard to the erosion?
No, I mean in regards to COVID, whether those gathering places are going
Oh, thank you. Sorry. I think I would defer to the Parks Department, but I do believe that they will be following the protocol as it stands right now. As Sheriff Kemker said, this is a very rapidly changing situation. We're looking at things every day. We're making decisions based on the most current information, the most current data that we have on number of cases, et cetera. So, you know, there may be decisions forthcoming on state and local parks and beaches.
Any other questions?
Do we know anything more about the status of the COVID case at Holland Hospital?
Like a condition update?
Were the procedures followed there? I'm not sure. Does anyone who comes in contact with a person, any staff at the hospital, are there specific procedures that are followed there? Do people have to be quarantined? What's kind of the follow-up there in terms of people at the hospital who came in contact?
Sure. Yep. Great questions. Doc Heidel, if you could address the hospital protocols and isolation.
All I can tell you is that there are protocols in place, whether it's COVID-19 or Ebola or whatever. They take those protocols very seriously, and so they were followed. And other than that, I can't tell you other than just that they were followed appropriately.
Can you tell me whether the standard is that when somebody in a hospital comes in contact with that person, whether it's immediate isolation or whether they have to show signs and symptoms first before there's any?
Well, the first thing they're going to do is evaluate the patients. Hopefully the person will let them know the information. And if there's a red flag, that sort of starts the process even more as far as whether it's isolation or what they have to do. But again, that depends. It's a case-by-case basis on that.
I think probably it would also be best if you have specific questions about hospitals and what hospital procedures and protocols are. I would ask that you direct those to them. We certainly don't want to give misinformation. We operate in this public health space. We know that there are, protocols and procedures, but to be super specific about it, we might be speaking a little bit out of the scope of our knowledge and expertise.
Do we know how many tests per day out of the state's 115 Ottawa County has access to?
How many, are you asking how many tests we've done out of Ottawa County?
Like how many tests are available per day?
Oh. That is another changing situation. We know that there's been a shortage of tests. But we've been working very closely with our state partners and federal partners to ensure that we're getting more testing available. We're working with the healthcare community to try to make sure that there's access to be tested and to be seen by a provider. I don't have the exact number, though, at this point.
When you talk about shortage tests, can you elaborate on that? Do you know how many people
You wanna
have
take
been on
him?
the way or trying to get tested?
We don't know that, but we do know now that in addition to the state doing the testing, there are individual or private labs that are doing this as well, in addition to the drive-through testing that's being done at certain locations.
How long does Ottawa County think it will be until there are adequate tests for the demand asked for by residents?
Okay, you can follow up. Again, we're working with the state health department and even the hospitals, the healthcare systems, even looking at commercial labs. We're looking at all the different methods that we can to make sure that we're getting the right number of tests that we can provide to people who seem to need the testing based on their risk assessment. So more information is to come on that. We're still developing those strategies and seeing what numbers we can get. But at this point, we're still waiting on more information. Any other questions? All right, well, we appreciate everyone's time. We are looking to hold daily briefings. At this point, we will plan on 4:15, set up again at 4. I will keep every one of you who received the media advisory updated on if there are any changes. But other than that, you can also check our website, miottawa.org/MIHealth. Thank you.
You've been listening to a live news conference out of Ottawa County and the Health Department, really reassuring residents that they have a plan in place, and it spans several departments.
It was a reassuring to hear from these officials. I think they wanted to get their face out there just to let everyone know they're on top of it. That was the quote. We are on top of it. They're tracking this as closely as anybody else is. Obviously unprecedented times for folks in their capacity, just trying to manage this on a day-to-day basis and keep people calm.
Right, the Ottawa County Sheriff's Department having some changes there. Jail staff has safety measures put in place. Road patrol still in full force. Fingerprinting is being suspended at this time. But for the most part, things are, they're adhering to the plan that they have in place to make sure that they take care of the people's health in Ottawa County.
The old adage, no news is good news, certainly applies in this case. No new cases identified out of that press conference. They are investigating suspected cases, but again, no confirmation of those either.
Also mentioning 211 if you want to contact the United Way to see if you can help with volunteering or donating goods to those that may need food or something like that. That is an organization that they want to certainly tap into to make sure and take care of people as well.
We're putting the finishing touches on the 5 o'clock newscast. We'll rejoin you in about 10 minutes with the very latest on what's happening not only in Ottawa County, but in West Michigan and the nation today, as there have been some fast-moving developments on all of those fronts. We'll bring that to you live beginning at 5 o'clock.